In November 2014, Secretary Bob McDonald announced MyVA, launching the largest transformation in the history of the U.S. Department of Veterans Affairs. At the heart of this sweeping change were two goals: enhance the veteran experience and improve the experience for VA employees across the country. 18 months later, we are seeing tangible successes, and a culture shift is underway. Here are the specific strides we've made. We are regaining veterans' trust. In 2015, 47% of veterans surveyed said they trusted VA to fulfill its mission. That number has since risen to 59%. And now, 74% report they get the services they need, up from 65% a year ago.
Being a values-based organization is really critical for change. And I think because the VA started with sort of a recommitment to their values, I think that's one of the main reasons they've been able to restore trust. But they've got a long way to go, and it's going to take one person, one veteran at a time. And as long as I think we're all working together, we're transparent, we're collaborative, and we're putting the veteran first, then we're going to get there.
We have emerged from the 2014 waitlist crisis to create the most accessible healthcare system in the United States. This is a top priority, ensuring that veterans receive the care they need, when they need it. By the end of 2016, more than 160 sites of care will offer same-day access when medically necessary. And we've increased access for those seeking primary care appointments, cutting the wait time for a routine appointment to 4.6 days.
I shattered my arm. It was really bad. I secured mess with my doctor at 6 p.m. that night. By 8 p.m. that evening, my doctor had written me back and said, show up at the VAMC at my office at 8:30 in the morning tomorrow morning. I'm going to squeeze you in and get you in for the appointment.
We have reduced the disability claims backlog by approximately 90%, and we continue to improve that number and modernize. As part of these efforts, we have transitioned the process for disability claims from paper-based to fully electronic. In March 2013, veterans waited an average of 282 days for a claims decision. By July 2016, the average wait time was down to 123 days.
Well, last year, VBA completed its comprehensive claims transformation, and what we got at the end of that result is a 90% decrease in backlog of disability comp, as well as a process that set veterans up in the future to have much more control over how, when, and where they are able to put in their disability claim and how they're able to receive their disability claim.
VBA is delivering more and more benefits to veterans. In fiscal year 2015 alone, veterans received 1.4 million C&P decisions. Veterans received 631,000 VA guaranteed home loans. Veterans and their families received $12.3 billion in benefits to go to school. And veterans received $1.1 billion to rehabilitate to suitable employment.
It's really easy. People think it's hard to use the GI Bill in school, and it's not. It's a seamless, easy program that the school does most of the work. And, the benefits are just unbelievable. While everyone else is working and scraping through college, you don't have to. You can concentrate on your studies and that transition into becoming a civilian again.
We've made enrolling in healthcare much easier. Veterans can now enroll through a convenient, easy-to-use website. Launched June 30th, this new option has cut enrollment times in half to just 24 minutes. Since then, more than 35,000 veterans have applied for healthcare online.
When you think about the number of websites before vets.gov, became the ideal paradigm for engaging VA electronically. You had different websites. You're not sure if they're even related to each other in a way that doesn't require the extra steps over and over again. So I'm happy to see the evolution of that single interface for us.
The Veterans Crisis Line is saving lives. From October 2015 through July 2016, Veterans Crisis Line responders answered nearly 420,000 calls, initiated the dispatch of emergency services nearly 10,000 times, answered more than 44,000 chat requests and another 13,000 texts.
The Veterans Crisis Line started in 2007 with about 15 responders at that time. We are now up to hundreds of people who answer calls or reaching out over our Veterans Chat system, as well as our texting service.
Since 2010, the number of homeless veterans in the United States has been cut in half. 2 states and 29 U.S. communities have ended veteran homelessness. And in the Los Angeles area between 2015 and 2016, the overall homeless population increased by 7%, while veteran homelessness declined by 32%.
When you leave the domiciliary, you're insecure. You're afraid of some pressures and responsibilities because you don't want to go back to your old way of life. But the HUD Dash program was that safety net that I needed. There's resources available at the VA, and if you don't use it, shame on you. It's there, that's why it's there. And I finally woke up to that.
The National Cemetery Administration continues to deliver top-notch customer service, and the organization is making even more improvements. NCA maintains 4.3 million gravesites in 134 national cemeteries, all the while ranking first in customer service, according to the American Customer Satisfaction Index. 74% of interments are currently scheduled within 2 hours or less, and families of veterans are now able to learn the benefits eligibility status of their veteran loved ones before they pass, helping them plan ahead for the most difficult of times.
For me, what makes NCA such a great place to work is the commitment from my coworkers. Here in Dallas, 90% of our employees are veterans themselves. Working side by side with them and seeing their passion for the families that we serve brings an immense amount of pride in what we do each day. After all, this is the last opportunity we have to do the veteran and their family right.
VA is more involved in local communities than we've ever been. Community veteran engagement boards are essential. They are the linchpin between VA services and the many community resources available to veterans. Already, 80 MyVA communities have been formed across the nation, with the goal of having 100 communities by December 2016.
For us, it was important to have everybody on that board really be connected, and we have made selections of people who are working directly with veterans. And so they're going to hear what they want to be brought to the VA.
Our Office of Information and Technology has undergone its own transformation, restructuring operations and changing the way it does business. In fact, out of 24 federal agencies, OI&T was ranked 5th in OMB benchmarks for highest IT customer satisfaction in 2016. That's up from 19th just a year earlier.
It's a time of change, and it's a time where all things are possible, whether you're a man or a woman in a technical field or a management field. If we keep the mission at the center of all that we do, together all things are possible.
We are efficient stewards of taxpayer dollars. VA has transformed its supply chain to help save and reallocate funds when purchasing medical and surgical equipment. This has already led to a cost avoidance of more than $90 million. Funds already redirected to priority veteran programs.
We looked at really how we were spending our resources and believe we can make a huge difference in that. And we started, one of the breakthrough initiatives was really transforming our supply chain. How do we look at all of that to streamline and transform our process so that in the end, we give better value for taxpayers, still providing the right items that our veterans need for their care, and providing the best environment for our employees to operate in.
Accessing community care is more seamless for veterans. VHA now offers a network of more than 350,000 community providers, an increase of 45% since October 2015. And the number of appointments being made with community providers increased from 17.7 million in fiscal year 2014 to 21.3 million in fiscal year 2015.
VA's plan is a long-term vision to provide better access to community care for veterans and simplify the process for everyone involved. In creating this plan, we made sure to incorporate industry best practices and feedback from veterans, VSOs, VA employees, and federal stakeholders.
By investing in our employees, our workforce is becoming more engaged. while we have been working to ensure that critical positions are fully staffed. Our Leaders Developing Leaders program has trained more than 93,000 employees, and our VA 101 program, a course about all the benefits and services that VA offers, has trained more than 118,000. The VA Employee Engagement Index, a barometer tied to mission success, increased to 62.34% this year. And we continue to move away from traditional approaches by looking to the private sector for new ideas and best practices.
We are now going into an area which is far less rigid in terms of expectations for how we do our work. We are starting to allow our employees to work, act, contribute in ways that are most meaningful and most comfortable for them. Now, let me quickly add, it's not happening everywhere across the board, but in certain pockets, I'm seeing that our leadership, our supervisors, our managers, and our employees themselves are starting to feel more comfortable with trusting employees to go in that direction.
We are shifting from a rules-based to a principles-based culture. We are empowering employees to do the right thing for veterans.
On Saturday, July 9, 2016, I received a call from the National Scheduling Office asking if we could approve a Saturday burial for one of the Dallas police officers that was killed earlier that week. Now, we usually don't authorize weekend burials at our level here at the cemetery, but I made an executive decision and I authorized the weekend burial. I notified my director and the district office right after I did this, and while I realized I did not have the authority to make this decision, I was willing to take the risk knowing that it was the right thing to do.
We are spreading best practices from facility to facility, which is resulting in positive change. VA's Innovators Network is a community of VA employees who are actively engaged in work that is moving the agency forward. They turn innovative ideas into action at facilities across the country. The Diffusion of Excellence Initiative then puts the ideas that work, VA's best practices, onto a platform that has enabled more than 350 replications in less than 1 year.
This was a perception of an individual's ability to innovate, and over the past few years, that number as a whole for VHA overall had started to decrease, and this was an opportunity to really intervene and provide a grassroots effort for our employees at the ground level.
Strategic partnerships are helping us serve veterans in new and better ways. We have realized the potential for partnerships across industries with companies like Google, Walgreens, Bristol-Myers Squibb, and others. And here's one example. Our partnership with IBM will increase access to genomics treatment for 10,000 VA cancer patients over 2 years.
It's incumbent upon us to take advantage of this sea of goodwill that's out there for veterans. We can't do it alone.
We are building trust with external stakeholders.
My perspective with the VA is twofold. One, it's as an executive director of a national veteran empowerment organization, and two, it's as a customer of VA care. And what I've seen has been simple. It's a vast improvement, frankly. Not only since MyVA has really taken into effect, but since the current leadership team and the culture that they've really emphasized has taken root since Bob McDonald and company took over about 2.5 years ago.
And we're not done yet. We've helped lay a foundation for success over the past 2 years, but we must continue to find new ways to meet the needs of a diverse veteran population. We have to prepare for the increasing numbers of women veterans and make sure they trust VA for their care. We must continue to conduct groundbreaking research on traumatic brain injuries, PTSD, and improved prosthetics to ensure we can meet the needs of post-9/11 veterans. Our transformation will continue until all veterans receive timely benefits and care, until every veteran and employee can proudly say, "This is my VA."